Folsom,
Here.
Cynthia Rucker,
Here.
Tommy Hopkins,
Here.
Norm Boyd,
Here.
Anthony Williamson,
Here.
David Cruz, Shane Mobley,
Here.
Robert Coles, Kathleen Ruth. Here. Chairman, that concludes my roll call.
Well, having concluded,
This
we
is
have a
David Cruz,
quorum.
I'm here.
We'll call the meeting to order. We had two sets of minutes and two meetings in June, and we will review those minutes. Tommy, have you reviewed those minutes, and would you make a motion for approval?
Mr. Chairman, I review those minutes previously sent to the board, recommend we approve.
We're having a little difficulty understanding you. Tommy, I'm assuming you have approved the minutes.
That's correct.
Okay, we're hearing you. Okay, we entertain a motion for approval.
Motion for approval.
Norm Boyd has made a motion for approval. Is there a second?
Second.
Kathleen Ruth has seconded. So any further discussion, additions, or corrections? Hearing none, all those in favor of the motion signify by aye.
Aye.
All opposed, no. Motion carries. The minutes are approved. Earlier this morning, there was an audit committee meeting. And David, if you've joined us, I know you chair that committee. If you'll give us a report on the meeting.
Thank you, Mr. Chairman. The audit committee met this morning and heard a number of updates provided by David Chong, Deputy Inspector General, and also Joe Hood, our Chief Operating Officer, went through several updates on audits. There are several audits that have been recent completed that they reviewed. They also there are several audits that are in progress that they gave us updates on. Most of the meeting focused on a thorough review of the audit for the personal care home program performance audit that was provided by the Department of Audits and Accounts. Lisa Davis went through the findings of that audit and with Joe's help and others on the team, they went through and explained the department's responses to the findings and gave a very thorough report, which the committee felt like was a good response to the audit. There are some items that were in the findings that really require the General Assembly to address, and the department, of course, could not address all of the findings for that reason. But we had a very good meeting. The committee is going to meet again September the 11th, so that we can hear a report from the department on the FY 2024 Georgia Annual Comprehensive Financial Report and Single Audit, and review those findings with the committee. So with that, Mr. Chairman, that concludes my report.
Thank you, David, for that report. Anyone on the board have any questions for him regarding the audit committee meeting? Hearing none, and we'll move on. Opening comments from me this morning will be very brief. We're glad to have a few of the board members assembled here in person several of us got to see each other in the flesh and blood for the very first time, and it was pretty good. So we're glad that for those that came. We also, unless you've been living in a cave, know we have a new commissioner. And we also have a former commissioner sitting out here too. I want to recognize Kaylee Noggle for being with us today. And but Dr. Dean Burke has been a voice in healthcare in Georgia for many, many years. He previously served in the Georgia Senate and was an advocate, strong advocate for particularly rural healthcare in the Senate, and has been a voice, like I said, in the state for many years. So we're very, very pleased to have you, Dean, as the new commissioner and on board with us. And so your very first meeting, I'll call on you for a report and some remarks.
Thank you, Mr. Chairman. Wish I could say I was delighted to be here, but it's, I remember my first day as a resident. You walk into a hospital with a white coat and they call you doctor and you don't know what you're doing. It's a scary feeling. So first day in the legislature, you have to vote on things and people are asking your opinion and you don't even know where the bathroom is. And so I've had some of those kind of feelings this last 2 weeks that reminded me of some of those transitions I've had in my life. But I want to thank you, Mr. Chairman, the board members here and online for all of the well wishes that I've gotten, and certainly want to thank the staff. I've had many of them to stop me in the hall and reach out and congratulate me on my appointment. And it means a lot to have folks look at you as somebody that they think can help lead. Obviously, want to thank the governor and his staff for their support for my appointment as well. And I want to thank Russell Carlson for the leadership that he showed all during his tenure here. Obviously, Kaylee was responsible for hiring me. She probably regrets that decision, but I did work as chief medical officer for a couple of years before this appointment and got to know the agency well. But finally, want to thank my wife and my children and grandchildren. Mr. Chairman, I'm at that age where I could be playing golf every day and drinking coffee with the guys, and I feel like I've got things to offer the state still and want to continue my work, but I did have to get permission, as any of you that have been married for very long understand that process. And my wife, children, and more importantly, my grandchildren were all supportive of me continuing to spend time in the business or public sector to try to make things better for Georgia. And I want to thank them for their support. A couple of issues is we've got a busy agenda today, so I don't want to spend a lot of time, but there are a couple of issues that have been active on this past week or two that I think we need to share with you, but they do not require any board action. The first thing, and this is certainly interest to Kaylee, is the rural transformation funding that was part of HB1. For those of you that may not be up to speed, HB1 had a funding for rural health initiatives, and the state is scheduled to receive $100 million a year for rural healthcare initiatives for 5 years, with another $500 million that all the states will compete for. So we will be looking at that program very, very carefully. Unfortunately, we don't have all the rules yet. CMS is going to let us know next month some of the guidelines, but because we understand from them that our plans have to be in before the end of the year, we've already started to try to prepare for what we think is coming, and may have to shift some once we get the final rules. But we've already opened a portal for our stakeholders in the state, anyone that has an interest in making recommendations or suggestions, that's available on our website. And we certainly encourage everyone to spread that word widely. And that comment period will be open to the end of the month, because we've got to quickly pivot to actually developing a plan and then implementing a plan. The government will provide us limitations on what that funding can be consisted of. One of the things they've already made clear is that these funds should be used for things that would sustain itself. So it wouldn't be something that you could do pay raises, for example, that you would have to continue those after that 5 years is up. They want something that would actually stabilize the rural healthcare environment and be self-sustaining. So there may be other limitations on who, where, and when, and we'll certainly be informing you guys of that as we learn more about it. Our SHP folks have released the pharmacy benefit manager procurement. We've had 5 companies complete the intent to apply, and so that is an ongoing open procurement. Sean Walker is the point person for SHPP for that. So anyone that has any questions, because procurements are legally sensitive, you have questions about that procurement, you need to go through her, and her contact folks. Information is on the website. The other thing we've been getting a lot of questions about is HB1's impact on our Medicaid program. And again, we're still getting input from CMS. Our pathways to coverage waiver is renewal is in their hands, CMS's hands, and they'll be contacting us shortly to give and take on that waiver. And because of HB1, there's certainly going to be some changes. Normally those waivers, if they're approved, are 5-year waivers. And we feel like it's unlikely we will get 5 years because we're going to have to pivot to make sure our pathways program is in alignment with the things that were in HB1. So we'll, again, hear more about that soon. Mr. Chairman, I'm available for questions, certainly. And if there are none, I'd love to begin the process of honoring our employees that have reached milestones of service here.
Are there any questions for the commissioner? Proceed on that,
All right.
please.
Thank you. We've got 2 months of milestones because we didn't meet last month. So we're starting with the July folks. Bonnie Young at OIT is 15 years of service. Leanna Bonner, Healthcare Facility Regulation, 10 years. Natasha Daniel at MAP for 10 years. Cynthia Butts at HFRD for 10 years. Andrea Crook at Financial Management, 10 years. Marisol Owens at the OIG office, 10 years. Jamie Kramer at MAP for 5 years. Demetria Mabry, HFRD for 5 years. Angela Cater at MAP for 5 years. Alexandria Williams, HFRD for 5 years. Tiara Ivy at Office of Human Resources at 1 year. And Deborah Bassett, HFRD for 1 year. Our August milestones are Sandy Dawson at HFRD at 15 years. Stephanie Ashlaw at MAP for 10 years. Avery Flower, OIT for 10 years. Brian Day at MAP for 10 years. Vonetta Sloan at OIT for 5 years. John Tavia Cobb at the Office of General Counsel for 1 year. Jasmine Jones, Financial Management, 1 year. Carla Willis, CMO Performance Management, 1 year. Jameer Taylor, Healthcare Facility Regulation Division, 1 year. And finally, Angela Johnson at the Georgia Board of Dentistry and Pharmacy for 1 year. So we want to congratulate and thank all those employees for those important milestones, Mr. Chairman. With that, I'll hand it back to you.
Well, thank you for your report, and we look forward to your leadership, Commissioner, as we move forward. We certainly want to echo our appreciation to all those employees celebrating milestones also. As stated, we do have a busy agenda today in front of us, and we'll begin with several informational updates. And Joe Hood, who is our Chief Operating Officer, will present the first one, which will be medical assistance plans and the public rural obstetrics directed payment preprint.
Good morning. Thank you, Mr. Chairman, Commissioner, and board members. As stated, my name is Joe Hood. I'm the Chief Operating Officer for the Department of Community Health. Today, I'm presenting 5 items at which are related to the supplemental payments for direct payment preprints. But before I begin with the first item, I would like to explain the relevance of these 2 informational items and how they are tiered into the overall compendium of direct payment preprints that you already approved at our prior meeting and that we will consider for final adoption today. As the Commissioner referenced earlier, since our board meeting, there was the passage of the Big Beautiful Bill. And with the Big Beautiful Bill, there was a provision that we weren't aware of at the original time that we presented the DPP preprints to the last board. And it's a specific provision for rural preprints that calls them out specifically. And with that in mind, we took the opportunity to bring forward 2 preprints that we had ready to submit, but we had not moved forward on, not knowing what the landscape of the federal legislation would be. But with that provision, felt it important and pertinent to bring those forward, given the timeline that's outlined in the bill, to present them to CMS. As a part of that, we had public notice, and that's why these 2 items are on the agenda today, because we're reporting out the public notice in the same manner as the remaining part of the preprints, and we'll bring them forward to CMS in that same manner. These 2 items actually tier into the same overall structure that we presented at the last board meeting, and I wanted to take a minute to explain that and explain the enterprise. So as you may recall, we have an HDPP, a hospital-directed payment preprint program, and that brings hospitals, largely most of the hospitals that participate, over 100, up to Medicare plus 10%. The next tier that we have in place is for teaching hospitals, and we have small teaching hospitals that have a starter program, if you will, or beginning, that get a different percentage above the 110%. And then we have our major teaching hospitals, which go up to 200% in the tier. And as you recall at our last board meeting, we did another tier for we called HIP, which would bring all those hospitals that are applicable, the majority of them from wherever they were at 110 or at 200 up to 400. With the inclusion of the rural obstetrics program for public and private, what we're doing is adding something similar to teaching hospitals, but the concentration is on rural public and private hospitals that provide OB services to bring them up close to the teaching hospital or beyond, in some instances, above 200%. Then they would still be in the structure to go to the 400% that is outlined in the DPP that was approved at our last board meeting and that we'll do final adoption and approval for today. So in totality, we're just adding a subsequent tier with these OB services. The importance of that, you may ask, well, why does that matter? We were going to go to 400% anyway with the HIP program for all hospitals. The importance of it is that each of these are independent, and we really don't know what the outcome of our CMS determination will be on any individual DPP. We believe, at the very least, our existing programs would move forward in totality, and we certainly have great hope that all of them will be approved in the form that we presented them. But if we have discussions and have to negotiate, we want the maximum flexibility to get as many DPP programs as we can for Georgia approved. And this gives us segmented independent pieces that we can negotiate in that manner and have discussion in the event that it comes to a part of choosing what would proceed and what would not. And particularly since this was called out in the legislation, that's why it's presented in this manner. I'm happy to answer any questions on that before I go to the first agenda item.
Any questions for Joe from board members? Okay, we'll move forward, Joe.
Okay, terrific. The first item that we had for informational purposes is as is reflected in the public notice, was a table for 2026 payments that would provide up to $39,476,324 in state funds via provider payment, because this is for public hospitals, that would potentially draw $78,012,735 in federal funds for a total benefit of $117,489.59. And what this would do is provide a supplemental payment for those public rural hospitals that qualify that provide OB services in a rural community to take them up to a percent over 200%. From public comments, there was an opportunity for them on July 16th, 2025 at 3:30. And then there was other written comments due before July 23rd at 2025. We did not receive any public comments at the public hearing that was presented. However, we had written comments from Carrie Summers, the CFO for the Georgia Hospital Association, expressing strong support on behalf of the 150 member hospitals. The department appreciates the support and comments from the Georgia Hospital Association in support of the Rural Public Hospital DPP program. If there are no questions on that, Mr. Chairman, I'll move to the second informational item.
Any questions for Joe from anyone? Okay, move forward, Joe. Thank you.
The second item is essentially the same. It is a public notice that was presented for private rural hospitals for the DPP program. The difference is that the state match is met through assessment of those hospitals combined, and then it would have the same benefit approximately to those private hospitals rising above 200% as an interim step. And from that, we had basically the same comments that we had on the public comment from Carrie and from the Georgia Hospital Association in support. We did not receive any negative comments in that respect. And we expect that that will move forward for consideration as a combination, public and private, to CMS. And we expect we'll get feedback and questions as we proceed in that process. If there are no questions, I'll move to the next agenda item, which is the waiver.
Any questions for Joe? Hearing none, let's move forward, Joe. Thank you.
So as you recall, we presented a waiver proposal at our last board meeting, which is adopted for initial adoption. The waiver is a necessary methodology change for the collection of state matching funds through the assessment of applicable private hospitals. It does not have an independent cost report, a cost impact. So there's no table in the public notice or to your board through your board informational materials. However, without the approval of the additional freestanding children's hospitals that are added, and we will talk about in a subsequent item, and the portion of the newly proposed HIP DPP assessment proceeds in the manner in which it is provided in the formula, we cannot proceed as outlined for the current proposal. Essentially, the waiver allows for the HIP DPP and the amendment to the HDPP of freestanding children's hospitals methodology of private assessment to be approved and to operate for the DPPs as a whole. Therefore, the Georgia Department of Community Health proposes to submit a request to the Centers of Medicare and Medicaid, which we have subsequently done after initial adoption, for the waiver of broad-based and uniform requirement under 42 CFR 43.68 effective July 1, 2025. An opportunity for public comment was held on July 2nd, 2025 on the submission of the waiver at 11:30 a.m. via Zoom, and the written comments were due July 9th of 2025. There were no oral comments presented at the Zoom meeting. However, there were written comments received. First, Kaylee Noggle, President and CEO of the Georgia Hospital Association, has expressed strong support of the proposed waiver on behalf of the member hospitals. She stated the waiver will provide the necessary financing mechanism for the corresponding updates to the state's hospital affiliated directed payment preprint programs. These changes will help advance key state health policy objectives, including improving maternal, pediatric, and expanding access to behavioral health services throughout the state, and supporting workforce development initiatives throughout Georgia. The department appreciates the support and comments from the Georgia Hospital Association. Next, we had comments from Thomas Worthy, Chief Public Health Policy Officer from Piedmont Healthcare, who expressed support for the proposed uniform tax waiver. Piedmont further requests that during any significant changes or adjustments that may occur during the negotiation, that we have a transparent process that shares that with member hospitals. The department appreciates the support and comments from Piedmont Healthcare and will take under consideration the request as applicable as the CMS approval process is undertaken. With that, Mr. Chairman, I would ask for favorable consideration and final adoption of the waiver submittal. Happy to answer any questions if there are any.
Any questions for Joe before we proceed with the vote? Hearing none, is there a motion for approval for final adoption?
Shane Mobley motions.
Shane Mobley has made a motion for approval. Do we hear a second?
Second.
Kathleen Roof has seconded. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion carries. Okay, Joe, we'll proceed with the next item, which is changes to hospital-directed payment preprint.
Thank you, Mr. Chairman. As you may recall, this was presented for initial adoption at our last board meeting, and it has a significant impact in an amendment to our existing program that would add freestanding children's hospitals to our program in the present year, and with the methodology that was expressed in the waiver exemption. When this proceeds, it would have a total impact of state funds through the HDPP program of $186,576,215, with a federal portion of $368,710,140, for a total impact of $555,286,355. Pending approval by the Centers for Medicare and Medicaid, the Department of Community Health proposes to amend the Medicaid Hospital State-Directed Payment Program under managed care effective July 1, 2025. The amendment, in conjunction with the waiver of non-uniform assessment, would essentially expand eligibility to include Georgia's private freestanding pediatric hospitals. Under the current program, private acute care hospitals are eligible with the exclusion of the general counselor hospitals and freestanding children's hospitals, rehab psychiatric long-term acute care hospitals, rural emergency hospitals, geriatric psychiatric hospitals, and critical access hospitals. This proposal change removes the exclusion of the freestanding children's hospitals, thereby allowing them to participate in the hospital-directed payment preprint. The list of excluded providers would be revised slightly to also exclude geriatric psychiatric hospitals. This change is expected to increase provider funding for pediatric services to the Medicaid population and strengthen support for Georgia's pediatric healthcare workforce. The program currently provides for the aggregate difference between Medicare reimbursement and Medicaid managed care base payments, with an additional 10% for Medicaid managed care. An opportunity for public comment was held on July 2nd of 2025 at 10:30 a.m. via Zoom. And then there were written comments due before July 9th of 2025. There were no oral comments. However, there were written comments. The first and foremost was from John Smith, VP for Government Relations at Children's Healthcare, who expressed strong support for the change to add freestanding children's hospitals. He stated that the state's only freestanding pediatric healthcare system, Children's Healthcare, is deeply committed to advancing pediatric healthcare, and this proposal ensures Children's can fulfill its mission to make kids better today and healthier tomorrow. The department appreciates Children's Healthcare System for their support and comments in support of the proposed change. Next, we had a comment from Lori Ott, Executive Director of the Georgia Education Healthcare Commission, who provided comments of support for the proposal and urged the department and the board to ensure graduate medical education was a priority for the use of the additional funds received by the participating hospitals by requiring hospitals to fill GME slots as a condition of participation in the DPP program. The department thanks Ms. Ott for her support and recommendations. The department will consider the recommendations if they are applicable as the process continues with the CMS approval consideration. Lastly, we had comments from Kaylee Noggle, President and CEO of the Georgia Hospital Association, who commended the department for this proposal and its continued efforts to enhance the DPP programs. Specifically, she called out this amendment expands the HDPP program to include private freestanding pediatric hospitals, supporting specialized pediatric service and strengthening support for Georgia's pediatric healthcare workforce. The department appreciates the support of the Georgia Hospital Association and its comments. If there are no further questions, Mr. Chairman, I would seek final adoption for this recommendation.
Are there any questions for Joe? Hearing none, is there a motion for final adoption?
Tommy, so moved.
Have a motion for approval. Is there a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion carries. Thank you. We'll move to the next item, which is the Georgia Strong for Healthcare Improvement HIP Directed Payment Preprint. Joe?
Thank you, Mr. Chairman. Georgia Strong for Healthcare Improvement is a supplemental directed payment preprint program to qualifying Georgia teaching hospitals. The current Georgia Strong program was designed to provide supplemental payments in Georgia's teaching hospitals to primarily address healthcare workforce shortages throughout the state in its various healthcare disciplines. This proposed amendment expands the eligibility to non-teaching hospitals and proposes to increase the overall average commercial rate for all eligible hospitals, which in turn will increase the supplemental payments annually. Overall, the proposal, if adopted and approved by the board and CMS, will further strengthen the state's eligibility to improve access to healthcare throughout Georgia and increase the healthcare workforce. The adoption of the HIP DPP is projected to increase supplemental payments for the program by $856,346,394 in state matching funds, $1,692,303,588 in federal funds, for a total impact of $2,548,649,982. An opportunity for public comment was held on July 1st, 2025 at 11 a.m. via Zoom. Written comments were due by July 8th of 2025. There were no oral comments. However, we have several written comments that were received. The first written comment is from Lori Ott, Executive Director of the Georgia Education Healthcare Commission, who provided comments of support for this proposal and urged the department to ensure graduate medical education was a priority for the use of the additional funds received by the participating hospitals. The department thanks Ms. Ott for her recommendation and support and will consider the recommendations as the process continues with CMS after board approval. The next comment was from Kaylee Noggle, President and CEO of the Georgia Hospital Association, who commended the department for this proposal and its continued efforts to enhance the DPP programs throughout the state of Georgia. The department appreciates the support of the Georgia Hospital Association and its comments. The next item of support was from Julie Wyndham on behalf of Atrium Health Navicent, who is in support of the current proposal and the benefits it will achieve. However, she has requested, as Piedmont did earlier, that if there is a negotiation and there are significant changes, that the department have transparency in considering those and that they consider two specific items: to allow rural public hospitals to have an ACR methodology independently, and secondly, to allow for a public hospital ACR overall rather than a public-private combined model. The department thanks Ms. Wyndham for the recommendation and will consider the recommendation as it's applicable as we move through the process with the CMS approval of the existing proposal after final adoption. The last comment was from Sydney Wilkins on behalf of Emory University, who wrote in support of the HIP DPP. However, Emory also has the request that any adjustments that may occur in the CMS approval process be shared and the department ensure any change aligns with the state's guiding principles. The department thanks Emory University for the support and will take the recommendations, if applicable, under consideration as the CMS approval process continues to move forward. If there are no questions, Mr. Chairman, I would ask for final adoption.
Any questions for Joe?
This is Tommy. I want us to be sure that everyone understands how critical increasing GM is for our state. I hope as we move forward, we can try to segregate at least 20% of those funds for graduate medical education to fill current unfilled existing programs and add to new programs, period. This is critical for our rural and in general healthcare of our state, that we have more practicing primary care and general surgeons, et cetera, available to our people. So I hope that we keep that in mind, because this is dearly needed in our state.
Thank you.
Thank you.
Tommy, any response you want to make?
Thank you, Dr. Hopkins. Certainly, as Ms. Ott expressed as well, we certainly, as a department, understand the criticality of graduate medical education, and will take those efforts under consideration as we move forward in the process with each of the hospitals. Just as a reminder, we will have only the availability to do that in the hospitals where there is the opportunity for graduate medical education. I just want to make sure that the public understands, I know Dr. Hopkins understands, that really only teaching hospitals and those that have capacity can have those graduate medical education slots. This program overall addresses 150 hospitals, many of them rural and critical access hospitals, that will not have a graduate medical education nexus. So we certainly as a department understand that. We'll make every effort to ensure that we move forward with those where it's applicable in the large teaching hospitals primarily, and the smaller ones that have developed GME. And we certainly will have this as an independent priority with the Healthcare Workforce Board and other initiatives that will come forward for graduate medical education. But certainly appreciate his comment, and we'll have that as part of our discussion.
Thank you. Okay. Anyone willing to make a motion for approval for final adoption?
Hopkins, I'll make the motion.
Dr. Tommy Hopkins has made a motion for approval. Is there a second?
Shane Mobley, second.
Shane Mobley has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion carries. Thank you, Joe, for all those presentations this morning.
Thank you, sir.
We'll move next to our agenda item on the medical assistant plans, newborn screening rate change. Maxine Elliott, Deputy Executive Director, will present to us. Maxine, good morning.
Good morning, and thank you, Chairman Folsom, Commissioner Burke, and distinguished members of the board. As previously stated, my name is Maxine Elliott, and I serve as the Deputy Executive Director for Service Delivery and Administration within the Medical Assistance Plans Division. I am here today to present a proposed rate increase for the Georgia Newborn Screening Program and to seek your favorable consideration for initial adoption of this change, effective August the 1st, 2025, pending final approval by this board and the Centers for Medicare and Medicaid Services. This rate increase is being proposed pursuant to House Bill 68, enacted during the 2025 legislative session, which authorizes an increase in the reimbursement rate paid to the Georgia Department of Public Health for newborn screening services. The rate increase reflects the inclusion of Krabbe disease as a newly approved disorder on Georgia's newborn screening panel, as recommended by the Georgia Newborn Screening Advisory Committee. The Department of Public Health has historically been responsible for administering the newborn screening program, and it will continue its oversight of this critical public health function. Beginning August 1st, 2025, DPH will expand the screening panel to include Krabbe disease. As a result, the current newborn screening fee of $80.40 will increase by $7.93. The updated screening fee will be $88.33. This change reflects the cost of implementing the additional test and ensures the sustainability of the expanded screening program. The fiscal impact of this action for state fiscal year 2026 is as follows. The estimated state fund contribution is $138,813. The estimated federal fund contribution is $273,218, resulting in a total cost impact of $412,031. With this update, Georgia continues its commitment to early identification of potentially life-threatening genetic and metabolic conditions in newborns, ensuring timely intervention and improved outcomes for Georgia's infants. A public hearing date is scheduled for August 18th, 2025 at 11:30 a.m. The comment end date is set for August 25th, 2025, and final adoption will take place on September the 11th, 2025 at 10:30 a.m. Thank you all for your attention and consideration, and I will pause now to see if there are any questions.
Are there any questions? Hearing none, we'll entertain a motion for initial adoption.
Move for a motion for initial adoption.
Morgan Boyd has made a motion for initial adoption. Is there a second?
Second, Dr. Rucker.
Dr. Rucker has seconded. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Anyone abstaining, motion carries. Okay, we'll move to the next item, which is an informational update, notification of intent to submit CHIP state plan.
Thank you. I'm also presenting this morning a notification to the board regarding the department's intent to submit a state plan amendment under the Children's Health Insurance Program, or CHIP, through the Health Services Initiative Authority. This is an informational item only and does not require any board action. In participation and partnership with the Department of Juvenile Justice and the Criminal Justice Coordinating Council, DCH intends to submit this CHIP state plan amendment for the implementation of the Child and Adolescent Needs and Strengths, or CANS, assessment tool, effective September the 1st, 2025. The CANS tool is a validated, trauma-informed assessment instrument designed to capture behavioral health needs, risk factors, and protective strengths across 7 key domains as follows: life functioning, emotional and behavioral needs, risk behaviors, strengths, caregiver needs and resources, culture, and trauma history. The primary goal of this initiative is to introduce a standardized framework for assessing children and youth who are involved with or at risk of involvement in the foster care system, the juvenile justice system, and/or who are identified as children in needs of services, otherwise referred to as CHINs. These populations have historically experienced fragmented and inconsistent access to care, largely due to the absence of a common assessment platform across agencies. By implementing the CANS tool, Georgia aims to establish a consistent, data-driven foundation for care coordination, allowing for more targeted interventions, improved service planning, and long-term positive outcomes for children and youth at highest risk. The Health Services Initiative will launch in the following judicial circuits: Cobb, Douglas, and Middle Georgia, which also includes Candler, Emmanuel, Jefferson, Toombs, and Washington. Juvenile courts in these counties will be trained to administer the CANS tool and to utilize its scoring system to guide referrals and service decisions. The CHIP State Plan Amendment will also include federal administrative funding to support certification and training of court and system staff through the nationally recognized Praed Foundation, acquisition and deployment of secure technology to administer the assessment, and ongoing implementation support and monitoring. This initiative will be phased in and represents a foundational step toward building a more integrated behavioral health response system for our vulnerable children and youth across Georgia. Again, this is a notification for the board awareness only. No formal action is required at this time. And again, thank you so much for your attention, and I'm happy to address any questions.
Any questions from board members? We hear you none. Thank you for your presentations.
Thank you.
The next item on our agenda is the State Health Benefit Plan, 2026 Plan Design and Rates. Louis Amos is with us, who is Executive Director of the State Health Benefit Plan. Louis, good morning.
Good morning, Chairman Fortson, Commissioner Dr. Dean Burke, esteemed members of the board that are here present, and those who are joining us online. Next slide. Our purpose, as we know, the Department of Community Health purpose is shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen communities we serve. The agenda today, we're going to discuss the accomplishments during the 2025 benefit year that's still ongoing. We're going to do a plan overview and historical trends. We'll talk about the recommendations for the 2026 benefit plan year, which will include plan options, plan design, and member premiums. And we'll talk about the open enrollment process. Next slide. I want to talk a little bit about the accomplishments during the 2025 plan year. We've implemented the new Medicare Advantage contracts with both Anthem and United Healthcare through plan year 2029. And that was a result of the invitation for proposal process, procurement process that we did last year. We are continuing to focus on mental health services. As we all know, mental health is a very serious need in our state, and we are really focusing on that. We sponsored 2 mental health summit meetings for employer groups. One was held in Macon, another one was held in Brazelton with over 200 attendees. We are happily and excited about a mental health wellness summit for school system administrators that will be held in October. So Kaiser is sponsoring that, and we're really going to focus in working with school administrators about resources and things that may be available to assist them. I want to share a little update about the on-met health station, which is located adjacent to the boardroom. Last year, there were over 2,768 visits for vital signs and consultation. As a result, we do a survey, and 36% said they would have gone to the emergency room. And, you know, given discussions that we have with our third-party partners, I mean, average is about $1,600 per visit to an ER room. So that is, you know, feed itself. 68% of those who visited basically indicated they did not have an active relationship with a primary care physician. And we're looking at almost 5% out of 5 in terms of satisfaction. Next slide. We have implemented a pilot program for hypertension. This program is focusing in on rural areas where those who have hypertension will be given an opportunity to have coaching, counseling, and to take a more active role in the healthcare decision-making process. We've enrolled over 2,000 members in 90 rural counties. So this is a pilot project. Obviously, depending on the success of the project, we will implement it statewide. We're also excited. We're implementing with Verta Health, another pilot project. It's dealing with diabetes reversal. As you know, diabetes is one of the leading causes of, one of our leading cost factors here. And this pilot program will target over 6,000 members, and that enrollment will begin in October of this year. As indicated by our commissioner, we have now have the pharmacy benefit manager's invitation for proposal is now out and being solicited with a targeted completion date of the first quarter of 2026, an award and an effective date of 1/1/27. Next slide. Talk a little bit about plan overviews and historical trends. The annual claim payment change from calendar year 2023 to calendar year 2024, medical claims had about a 10.2% increase. Pharmacy claims had about a 20% increase. That's including the GLP-1s, weight loss drugs, that expansion. Cost drivers. Healthcare inflation. We've seen a significant number of increases in high-cost claimants. And, you know, when we talk about high-cost claimants, in the past, if you saw $1 million claim, you become a little bit concerned, but we have seen claims that have gone as high as $8, $9, $10 million. So we're starting to see an increase in terms of these high-cost claimants. And, you know, that's a result of people being real sick and transplants and other things. So that's a factor in terms of the plan's costs. As we know, we are in the South. We're in the middle of the stroke belt. That means a high number of chronic conditions, diabetes, hypertension, and obesity. But the overall main contributor in terms of cost is cancer. So the presence of cancer is really taking a significant impact in terms of the plan. Pharmacy, an increased spending on specialty medications and anti-obesity medications. I'd like to point out, for the month of June of this year alone, the plan cost for the anti-obesity medications, they're basically two drugs, Zepbound and Wegovy, was $37.2 million. So that's just those two drugs. We know that, you know, we put processes in place to make sure that there is a mechanism to kind of control usage as much as possible. But those medications, as you can imagine, are very costly. And we're anticipating, once the oral medications become available, that the number will increase. Well, people won't necessarily want to stick themselves anymore, but the cost, there will be a cost associated with the increase. Plan recommendations. The medical vendors will remain the same for the 26 benefit plan year. United Healthcare will offer an HMO, high deductible health plan, Medicare Advantage. Anthem Blue Cross Blue Shield will offer the HMO, the HRA, and the Medicare Advantage plans. Kaiser will continue to offer a regional HMO. Our pharmacy vendor will remain the same with CVS Caremark, and the wellness vendor will remain the same with ShareCare. Plan designs, next slide. The only recommended plan design that we have for the board to consider is that we are recommending changing the co-pays in terms of the generic drugs, and you'll see the structure in front of you. Currently, it's for a generic drug for our HRA plan, that's your gold, silver, and bronze plan. It's $20 minimum, $50 maximum. The proposed structure actually reduced that cost to $5 and $10 max. The significance of that is that obviously a lot of our members have these comorbidities and they're on various different drugs. So an opportunity for them to save on the monthly drug costs. On the HMO side, we're proposing a similar cost restructure reduction. The generics are now costing $20. We're proposing that they go to $5 and so forth and so on as you look at the drug costs. The only other change is that the brand and the non-preferred brand will increase by that $5 that we had previously charged this year. The goal of this is to increase generic medications usage, and that helps the plan cost overall. It also helps the members in terms of their monthly expenses. Next slide. I want to share a little information about the member premiums, and I think it's important that we look at this in terms of, we look at the plan over the last 10 years or so. Our average has been about 2% in terms of member premium increases. But as you know, the plan costs have increased on an average of 8 to 10% each one of those years. For example, last year, our average was we had recommended a 6. Kaiser came in with a 2% reduction, so it was 4.8% in terms of the premiums. But once again, I want to make sure everybody realizes that each year, we had 4 years where we had 0 premiums, but the plan cost was running 8, 9, 10% each one of those years. Next slide. I want to share with you the recommendations from the plan as it relates to member rates. Obviously, it's a little bit different and in the past, and I want to give you kind of some background information. Working with our consultant, Aon, working with DCH Finance and with the Office of Budget, we're anticipating a $615 million increase in costs next plan year. So in order to kind of maintain financial stability with the plan, we came to you in April and increased the employer contributions, which were effective as of July 1. And these contributions will be increasing on both the plan side and the employee retiree side. So what, as from a standpoint of the subsidy and how the subsidy is determined, everything is based on the bronze plan in terms of the subsidy. So you have the bronze plan and all the other plans subsidized at that same rate. Obviously, to buy up, it's a little bit higher, but it's a weighted average. So for our self-funded plans, that's United and that's Anthem, the average increase for an employee is $16.04 per month. And for the family, it's $59.40 per month. And I think when you talk about percentages, it's always better when people understand dollars because that's the bottom line impact. So what I've provided is some examples in terms of what the increases. For a member who's on the Anthem Bronze, the employee only is $9.45 for the employee only and $38.58 for the employee and family. The next plan, the Silver, Anthem Silver, $14.94 employee, $53.90 for employee and family. The Gold is $19.04 for employee only and $65.44 for employee and family. Anthem HMO, which is our largest plan, it's a $19.68 increase for employee, a $67.23 for employee and family. And just to go over one more, like Kaiser HMO, last year we had the HMO premiums for both Kaiser and Anthem to be similar. So that Kaiser increase will be $19.68 for employee only and $67.23 for employee and family. Next slide. Share a little information about the Medicare Advantage plans. As you know, we went through the procurement process, and for the first time for many years, that was a change in terms of member premiums for the standard plan. And last year, Anthem was the lowest cost standard plan at $20. United was at $82.59. The member paid the full difference in terms of if they wanted to buy up to Anthem's premium plan or either one of the two United plans. Next slide. So we're recommending no benefit plan changes for the 2026 year for the Medicare Advantage. I do want to point out that last year we had an active enrollment for Medicare Advantage participants. And what we did was we defaulted, it was about 130 or so, all of those members to the lowest cost plan, which would have been Anthem. As a result of that, they had choices. 47% of the retirees elected to go back to United to pay that higher cost. So they had a choice. They made the decision, from a personal standpoint, and they went on to back to United. This year, there are changes from a regulatory standpoint from CMS, market trends, increasing claim costs, and it's impacting the 2026 rates. But for this year, for the 2026 plan year, we're recommending a $10 increase for the Anthem Standard Plan, which has the most, highest number of members. And for the United Standard Plan, it's about a $26 increase. And once again, if the retirees don't want to make any changes, they will automatically be put in the plan that they're currently in. Open enrollment. Our open enrollment process begins on October 20th through November 7th. Plan members are asked to take full advantage of the 24-hour, 7 days a week enrollment portal. We will be conducting the meetings, the open enrollment meetings, both on the retiree side and the active side throughout the state. And we are looking forward to a successful open enrollment period. I now pause for any questions and respectfully ask the board's approval for our recommendations. Mr. Chair.
Any questions for Lewis, from the board members?
I have a question.
Go, Shane.
In regards to PBMs, it's been sort of something I've been pretty outspoken about. And do we have guardrails at all regarding the PBM submission as far as some of the, if they have to choose if they're gonna be a PBM or if they're gonna be a pharmacy? Are there any guardrails on that? Because particularly, CVS Caremark, I want to say in Arkansas, they basically passed a law over there, and unless something has changed, they were given a choice, and the governor signed it into law over there. They had to choose whether they were going to be a pharmacy or whether they're going to be a PBM. They chose to shut down all their pharmacies and to just stay as a PBM. So my concern is, are we going to have guardrails that we make them adhere to if they're going to try to stay in our state as a PBM? Because one of the biggest problems in rural healthcare, and a lot of us are rural, they'll tend to, if they can't make enough money in a rural market, they'll just shut down the pharmacy and leave. The problem is that if there are local pharmacies there, pharmacists that want to open up that pharmacy again or in their local community, they can't afford to do so because CVS Caremark is the PBM. So they're controlling the amount of money that these pharmacies are getting. And so because of that, they can't afford to go in and open up the pharmacy, especially when in many cases they pay themselves $40, $50 for a drug, and they'll pay the independent pharmacy like $1.50, $1.75 for a drug. So they choke out the market. So I hope that we have some guardrails and we put something in place that as these people do these submissions, that we're going to make it so that all of Georgia wins and not publicly traded companies that are PBMs as well as the gatekeepers. Part of CVS, they shut down at 2:00 every day. Not at 2:00, they shut down for 2 hours every day. In many cases now, if you have to have a patient with a prescription that needs to get filled the same day, they can't get it the same day. They'll tell you to come back another day. So I really do hope that we have some guardrails, and have you guys consider that on the state health benefit side as far as that's concerned?
As you know, Mr. Mobley, the procurement process is currently underway, so we're limited in terms of amount of discussions, but we do feel it is a very inclusive and administratively responsible procurement that is currently being out there. So we are confident in that. But if there are any questions, general questions, as the commissioner indicated, Sean Walker is the procurement person, project manager, and Chairman Dr. Burke might have some additional. Commissioner Burke, I'm sorry.
I think the legislature weighed in last year with some things that
Yes.
we have to implement, and certainly those things are part of our current, this upcoming contract with CVS, who holds the current contract until that expires. So we're making some significant changes in the technology and processes to address the issues and concerns that were brought up during the last session. As
This is Tommy again. I want to echo what Mr. Mobley said. He's right on target. He said, very well said, Mr. Mobley.
Thank you. And
You-
thank,
you have-
and thank you, Commissioner.
Louis, do you have anything additional you want to add?
No, Commissioner, Dr. Berg basically indicated that for the 2026 benefit plan year, we have, based on recommendations from the legislation, we will be including like the NADAC, National Average Drug Acquisition Cost, will now be put into place starting January 1. So we are following what the legislators have recommended, and then obviously we'll go forth in the procurement process to make sure that we address some of the other concerns that have been raised throughout the state.
I gather from that, we're making progress, and I'd like to see us making progress.
I sure hope so.
Yeah.
Because I go to a lot of rural communities with no pharmacies right now and empty CVS buildings.
Yeah, it's become very apparent. Okay, Lauren, you had a question?
Just a quick question. You talked about the increased cost of things that we cover, like weight loss drugs and expense of that, et cetera. I assume we compare what we cover with the private sector where we compete for employees, et cetera. Are most private sector PPO plans, for example, cover those kinds of drugs?
It's kind of a mixture of both. We work with Aon, who's our consultant,
Right.
and they review governmental plans.
Yeah.
They also review their other plans, and we are favorable or equally on par with what the other private sector is doing. As you know, for us, the most important thing, benefits play a serious role in terms of retention and recruitment. So that kind of helps us. I can say that we are on par in terms of what's going on in the marketplace. As you know, the anti-obesity drugs, there are both private sector and public sector. Some are changing and getting out of it, but there are others who are considering. And then on the national level, there's been some discussion as potentially for both Medicaid and Medicare that there may be some level of drugs that may become available at some point in time. So,
And obviously, over time, the healthcare costs should go down because of drugs like that.
yeah, so that's the goal. We're still in that process. Yeah.
But it should happen.
Yeah,
It
yeah.
logically should happen.
Yeah. So we're still, as you know, it's still fairly young, but we are monitoring that obviously because of the impact and the potential effects that these drugs may have on cardiovascular disease. It's obviously obesity, diabetes, and hypertension, and some of those other diseases. So we will definitely kind of look at the return on investment as it relates to those drugs.
Thank you.
Any further questions from Louis? Any board members? Okay, we have these resolutions. We need a motion for approval. We'll take it in one motion.
Shane Mobley motions.
Have a motion for approval from Shane Mobley. Do we have a second?
Second, Kathleen Ruth.
Have a second from Kathleen Ruth. Any further discussion? Hearing none, all those in favor of the resolution signify by aye.
Aye.
Opposed, no. Anyone abstaining? Motion's approved.
Thank you,
Louis,
Chair.
thank you
Thank you,
for your-
Board. Thank you for your support.
Comments this morning. We move to the next item, the new business, and we do have some business to conduct today. We have an item of business to elect officers for the board for a one-year term. And to that end, I'll ask Chair of the Nominating Committee, Norm Boyd, if he has a report.
I do, Mr. Chairman, and the nominating committee is appointed Anthony Williamson and Dr. Ruth and myself. We met to discuss this and we were given the input that, and thank her for her service, Dr. Rucker had asked that she not be considered for continuing as vice chair due to her current schedule for her personal time, that she doesn't have the time for. So we asked not to continue in that position. So we considered nominees for the positions with that in mind. And our nominees that we would like to present for election today is for Chairman Roger Folsom to continue in that position, Dr. Tommy Hopkins to move to Vice Chair, and Dr. Kathleen Ruth to be Secretary of the Board. And so we submit that, Mr. Chairman, for approval.
Well, thank you, Chairman. Okay, we'll move. Is there a motion for approval of that slate of officers?
Shane Mobley motions.
Shane Mobley has made a motion for approval. Is there a second?
Second, David Cruz.
David Cruz has seconded. So all those in favor of that slate of officers serving for 1 year, vote aye. All in
Aye.
favor, by aye.
Aye.
All opposed, no. Okay,
Congratulations.
this slate will serve for 1 year. My pay will be the same and Tommy and Kathleen to come on at the same pay as also. So
Yeah.
thank you for your service. Thank you for that, Norm. Okay, we have several other items today. The most relaxed person in the room today is former Commissioner Russell Carlson. I saw him sneak in back, and Russell, you can come on down to the podium, I would expect. I think he's got a very, very relaxed look today. And I would like to say on behalf of the board, we appreciate all your years of service to the state, your leadership and direction for the Department of Community Health. And Dr. Burke's going to present to you your plaque for service.
Yeah. One moment.
Okay. Thank you, guys. Always on your toes. It's kind of one of those tough things to lose a friend in the workplace. And Russell and I have been working together for about 15 years in various capacities. So therefore, a time I felt like I was a mentor to Russell, who's, way, way younger than I am. I'm going to say it before he says it. And then I had to call him boss. So, for a little while. Now that was kind of tough, but I want to, on a serious note, thank Russell for his years of service to the state of Georgia and certainly to his time in leading this very, very challenging state agency, which also comes with great rewards of feeling like you're making a difference for millions of lives in Georgia. So I want to give him a token of our appreciation for his service, which I'll put over here. I won't make him whole because it's heavy. But I also I left him off. He had 10 years of service. So he gets one of these things that he's been giving away to people for the last several years. So
Thank you.
and I will turn this over to him.
Oh my gosh, I didn't know all that because Dr. Burke, before this meeting, he told me, just make sure you don't say anything or make eye contact with anybody. So I'm surprised you're letting me speak. No, thank you, Dr. Burke, and members of the board and to the team, past and present. And I'm very honored to have my wife, Anne Marie, and my parents, Jane and George, here with me today. And I'm very grateful. The time here meant a lot to me. I do, like you said, it's a challenging job, but you had plenty of opportunities to experience the impact that you're making on lives or trying to every day. And I'll say this because I know I said a lot throughout my tenure here, but I really want to emphasize it again for for you guys and for anybody watching out there. I truly am amazed, Kaylee and Mario, I think would agree that the amount of work that comes out of this department, the product, the good policy, the amount of work that comes out of this building on any given day, most of which when no one's looking, and most of the things that are done here are the type of issues where you don't have hundreds of people approaching you or calling you just to tell you how great you did, right? It's kind of a selfless service dynamic. And I've said it before, given my unorthodox commute, there are days I'd be walking around the building at 6 a.m. and there'd be nights I'd be walking around the building at 9 p.m. and there was always someone here. There's always someone here just trying to meet the target, just trying to solve a problem. And nobody else was looking. They were doing it just for the calling. So I'm very grateful to the governor for having the opportunity to begin with. I love the tenure here and everyone involved. And so thank you, Dr. Burke, for the award or the honor here. I appreciate it very much. Thank you. Here we go. I didn't wear my white gloves, so I didn't. Oh, this is very nice. Thank you so much. Shall I read it? You want me to read it?
Yep.
Okay. Honor Russell Carlson, Commissioner. On behalf of the board and our department, we recognize the significant contributions you have made in 3 years for the agency, our partners and constituents to promote accountability, transparency, and excellent customer service. We sincerely appreciate your vision, leadership, drive, and your heart for service. Thank you very much. Means a lot. Yeah. And so I believe I get to recognize someone now. Mario, where'd you go? Sure, she'll be right back. So what else you want to talk about? Go dogs. It's always a good foolproof.
Had to capture her.
Yeah.
Oh, yeah.
You thought he was finished, didn't you?
Well, if this constitutes my final act here, I'm honored to be doing it. So thank you, Dr. Burke, for allowing. So Mario Ellis held a lot of positions here for several commissioners to include, but beyond just these roles, but general counsel and then chief of staff before moving to the university system. I always, when she was leaving, one of the first reactions I had that Mario's judgment and understanding the agency is so sound that on any given day, on any given issue, when you're sitting upstairs at the big table, when discussions are getting a little interesting, I knowing or unknowingly, I would glance Mario's way constantly to kind of get a read on how these things were going, because I trusted her judgment so much, and she has a terrible poker face. So I knew I'd get some good feedback from it, and I found myself doing that so much, and obviously when you left, I was forced to, look at Joe, and that just doesn't have the same, those aren't the same tea leaves I was trying to read there. But But honestly, Marl, you're as admired and respected, a person who's ever walked these halls and did a lot for a lot of people. Again, as we were saying earlier, when no one else was looking. So it's an honor to present you with this today, and I'll read it here now. With sincere appreciation and gratitude for many years of dedicated service as general counsel and chief of staff, March 2012 to April 2025, presented to Mario Ellis from Commissioner Russell Carlson and Georgia Department of Community Health. So
Thank you so much.
thank you, Mario, for everything. Oh, gosh, thank you. Hey, I just had to do it.
Yeah, thank you.
Thank you. Thank you, Doctor.
And just a quick announcement before I turn it back to the Chairman. We do have some reception to follow with a cold drink and a little bit of barbecue in honor of this country guy who's retiring from our service. So make sure everybody goes next door and participate in that. Chairman Folsom, thanks for your grace in letting us do this.
My appreciation to you for doing it. Russell, we do wish you Godspeed, and we wish you all the success over in your new position. Thank you for your contributions to healthcare in Georgia.
Thank you, Mr. Chairman, members of the board. Thank you, guys, so much.
And ending, I will say appreciation to Governor Kemp for appointing Commissioner Dean Burke. We look forward to his leadership and guidance in this department, and we look forward to working with him. And to all the board members, we appreciate you that made the effort to be here today. And to those of you virtual, we have had a good meeting. We've covered a lot of material today. Our next meeting, as you recall, we have 2 meetings in August, and our next meeting will be August 28th. And we will see you then. If there's no further business, we stand adjourned. Thank you.